moving on. Hampton Creek. That's a small food company. It makes eggless mayo and cookie dough, amongst other things. It's taken out, or did on Sunday, took out a full-page ad in the New York Times telling the presidential candidates that we have some big problems because of our food chain. He says we need to fix the problems. The company's founder had this to say about it on the program yesterday.
An issue that doesn't show up in Poland because it's an underlying issue is this issue of food. Whether we're talking about racial relations and the issue of food deserts, whether you're talking about type 2 diabetes and obesity healthcare, or whether you're talking about supporting farmers now, it impacts the economy. And I think it's an issue we should shine a light on. And again, I hope one of those Republicans, one of those Dems steps up and does something about it.
I was trying to get a word in edgewise there. The man's basic point is that the food supply chain is the biggest problem that we face in America, and it's creating all of these other problems. Let's bring in nutritionist Keri Gans, who has something to say about this. Is he right or what?
I think he's definitely oversimplifying things.
Okay.
It's much more complicated than that.
I suspect he is either a vegetarian or a vegan, because he only deals in plant-based food.
Right.
So he's got, I think the man has an agenda. He wouldn't admit to it on the show yesterday, but I think he's got an agenda.
He possibly could. I can't say for sure. But what I can say is if we look at our obesity epidemic, you can't pinpoint one thing. And I think that's what he appears to be doing. And I can't get on board with that way of thinking.
According to the New York Times, the obesity epidemic, whatever you want to call it,
correct,
peaked in 2003,
yes.
And we've all started to reduce our calorie intake and our obesity levels since then.
That was an article that I recently read as well, and that was quite promising. I mean, it was like, wow, we are actually maybe getting somewhere, and that people are actually eating less. And that's what that article pointed out, was that people were maybe drinking less soda.
They were.
Okay?
That's right.
Somebody said that her child was having less dessert. So they were cutting back. They weren't necessarily eliminating, but they were reducing, and that's a step in the right direction.
What is your prescription for a good and healthy diet?
It's very
complicated.
Can you give
it to me 20 seconds?
20 seconds. You know what? Plenty of fruits and vegetables, whole grains, low-fat dairy, lean protein. I mean, it's portion control. And I think that's what the average American has not understood.
No, they understand it. They just don't
do it. They don't.
I understand it. I just can't do it.
But can't? I mean, that's a big word. Why?
I don't have the willpower always.
You know what? And I think that's when we're talking about overeating, there's a lot more that goes into it psychologically.
Yeah, sure.
A lot of people do overeat for various reasons, and you can tell them exactly what they need to do, and they won't listen.
Yeah.
You tried it, I take it.
I tried. My husband doesn't listen to me.
This is what you do for a living.
This is what I do for a living, and my own husband doesn't listen.
Yeah, wait a second.
Hopefully he's watching
Do you
now.
charge? I don't want to take this off onto a tangent.
Right.
Do you charge? You must charge.
For people to listen? Yes.
Yes, you do.
I do.
Can they put your fee on insurance?
Some, not all. And that's a whole nother conversation. Okay? That's a whole nother segment about how our health care doesn't necessarily pay for prevention.
Okay. Let's suppose, and I'm on dangerous territory.
Yes.
But look, if I came to you, do you run a clinic or an office?
No, it's a private practice.
An office?
An office.
If I came to your office and said, you know, Dr. Gans, I'm 20 pounds overweight. What can you do for me? You would put me on a course, I take it?
What I would teach you about is, yes, we'd have scheduled meetings, but it would be about teaching you small changes. I wouldn't say to you, okay, right now, you need to eliminate the burger and fries, you need to eliminate this, you need to eliminate that. Okay. Forget the negative talk. We need to talk more positively. First of all, I'd have to find out more about you. What is it that you do? What do you like to eat?
I go on TV and I wear makeup. I eat the same thing every day.
There we go. And then I would say, okay, and where are you getting your food from? What are your choices? Let's help you make better choices. Okay. There's not one prescription for everyone.
Okay, now this is a financial program, so I'll ask a financial question.
There you go.
At the end of this long course of meetings and advice and all the rest of it, how much?
Oh, it varies. I can't really say.
Give me a range.
It varies. It really varies from nutritionist to nutritionist, where you're located, what state, what city. Okay. Prices are different.
Wait. If I give you $1,000,
okay,
and I agree to do whatever you tell me to do,
right?
Would that be about right? $1,000?
No, it would be more than that.
More than that?
More than $1,000.
$2,000.
Everyone is different. It depends how quickly you learn and take my advice.
Oh, I'll take your advice immediately.
Then it's $1,000 for you, okay? If you took my advice immediately and really started listening to what I said, and people do, don't get me wrong, a lot of people make these changes.
Okay.
They do.
Bargain hunting nutritionist Keri Gans. Thank you very much for being with us.
You're very welcome.
For $1,000, I might just. You got to lose me 20 pounds.
Okay.
That's the deal.
Watch out, sports fans.